All right, if I can have your attention, please. We would like to start. We apologize for the lack of seats. There are extra chairs. Unfortunately, there are more parents, and I'm very, very happy that more parents have come. But I always go by the RSVPs and the confirmations. First, let me begin by welcoming parents and students. Our participants, we have participants from Athens. Where are the Athens participants? Do I hear you? Participants from the London program. Where's London? And participants from the Venice program. Okay. Just a thought to all our participants. At the start of the semester, when you decided to do a winter program, a January 2016 program, the excitement, joy, and enthusiasm were just incredible. In the wake of all the disasters, if I say less than a month ago, I was here addressing a group of students interested in Hofstra at open house, and we had to extend our condolences, myself and my colleague, because it was the day after the Paris attacks. Early this week, we had horrific mass shooting in California. So again, I express my deep felt condolences. The one thing that I keep thinking about is the enthusiasm that students have for study abroad. And I pray and I hope that that enthusiasm, excitement, and joy have not wavered. And so I welcome our students. I'm glad that we have such a gigantic group. To the parents, we send, on behalf of Study Abroad, Hofstra University, we extend our thanks for your continued support with Study Abroad and for allowing your child to embark on an experience that will be life transformative and will probably be one of the most exciting things that your child can be doing here during his college or her college career. So we welcome you. And at this time, I'd like to introduce as well, first welcome our panel of people that are here today that will join me in talking about health, safety, and well-being abroad. I'm going to introduce them. The director of our parent and family programs, Branka Kristik. Director of the Wellness Center, Dr. Maureen Hock. Senior Associate Dean for Budget and Planning, Hofstra College, Dr. Stephen Costanoble. Professor of Comparative Literature and Director of the Athens program, Dr. Barbara Lakatzis. English Professor and Director of the London program, Dr. John D. Gaetani. And Dean of Students and Assistant Vice President of Student Affairs, Sofia Pertuz. Before I start discussing our safety procedures, as per Hofstra University for our study abroad programs, I'm going to ask Dr. Costanoble to say a few words on behalf of Study Abroad, Hofstra College.
Good morning. We're on behalf of Hofstra College, on behalf of Hofstra University, I'm very pleased to be able to offer you these opportunities to study abroad, and extremely pleased that you're taking advantage of those opportunities. We're all very aware of as Maria mentioned, of the attacks in Paris, the recent attacks in California. I don't want to deny the the risks of terrorism, of these sorts of attacks, or denigrate anybody's worry, but I do want to put it a little bit in context. We started meetings like this a few years ago, not because of any thoughts of terrorism or any worries about that, but because of other risks that are actually, we think, much more significant. Risks that you also have a lot more control over. Risks that are basically the possible results of your own behaviors. So, yes, we're going to talk about safety in the context of terrorism and possible attacks, but we're also going to talk about what you can do to keep yourself personally safe and avoid, frankly, what are larger risks, because there are things that we've actually seen happen on these programs. More than ever, when you go abroad now, and you're going abroad to see other cultures, to see how other people live, but as you're observing those cultures, as you're observing those people, they're also observing you. And more than ever, they're interested in seeing what are American students like, what are Hofstra students like, what are Americans like. You are our ambassadors to the world when you take a trip like this. So go out there and do us proud. Thank you.
Thank you, Dr. Castronovo. You brought this up, and I'm going to just continue on what you spoke about as far as the pre-departure orientation. The pre-departure orientation did not start for reasons of terrorism and our safety concerns. It actually started, and I'm going to go into a little bit of history how we got started, and sometimes from something bad, something good comes. It was back in 2011 on a Venice program where I came back really frustrated as a director. And the first thing that I did is speak to someone who I've known now for a long time. We keep saying 14, 15 years, and we worked very closely together. But the second I came to campus, I called Steve and I said, I can't do it alone anymore. We need support services. We had a program with students who were totally out of control. After he listened, he said, don't worry, we'll set things up. And from that started the pre-departure orientation. We now have people here on campus, resources on campus, that work with us. Parent and family programs, the Wellness Center, the Dean of Students, so that we can make students understand how important and precious safety is, whether we're here on campus or abroad. So our first pre-departure orientation started back with our January 2012 programs and has continued since. So thank you for bringing this up. I'm ecstatic that you did, because I didn't want to start negative, but again, from something negative comes something positive. So we're here today during the general session to speak about your child's health, well-being, and safety. We cannot give to one person responsibility and say, we have Hofstra University here who is responsible for the safety of all our students, faculty, directors. Rather than one person, we have a concerted effort, a community effort, a collaboration between the program, Hofstra University, the student, and the parent. And if we can think of this collaboration, every student here today who's doing one of our January 16 programs, I assure you that you will have a rewarding and successful program. So what I'm going to do right now is we're going to start as far as Hofstra University. And what Hofstra University has in place, what our programs have in place for the safety of our students, as well as our directors and participating faculty members, but most important, the student. Hofstra's commitment has always been, study abroad's commitment has always been health, safety, and well-being. So what do we do to ensure this? We have procedures that are in place during pre-departure as well as once the student is abroad. So I'm going to review very briefly. By the way, I would ask all questions to be held for the end of the period, for the end of the session. Just jot them down. And I would appreciate questions that are safety-based, since this is the venue for it, okay? Getting back to the pre-departure period, students are requested to complete, along with the application process, 4 necessary forms. 2 of those necessary forms are medically based. One is a medical information sheet, and the other one is a medical emergency authorization form. These 2 forms are extremely important and valuable to the director, and they are delivered to the director. The director brings these forms with him or with her. As well, our office sends them to various key offices, such as the Dean's Office and Public Safety. The medical information sheet is completed by the student and includes concerns, health concerns that the director should be aware of. For example, if a student suffers from, let's say, migraine headaches or allergies, but any health-related issue that would be, that the director would need to know. Prescription medication, non-prescription, over-the-counter medication. The other form, which is the emergency authorization form, basically requests 2 contact names here, just in case of a medical emergency. And we actually had it on one of our programs 2 years ago in the summer when a student had appendicitis and emergency surgery was warranted. And actually, I was the one who received the call, and I was away for 2 weeks on vacation, and I was the one who had to call the parent. But everything worked out beautifully. Everything was done very, very, very quickly. All right, so these forms, one procedure. There is another procedure during pre-departure, which is called the travel consult. And students are requested to go to the Wellness Center for a travel consult. The travel consult includes anything related to travel and health. So any kind of vaccinations, if they are necessary, you will always meet with a staff member, a nurse practitioner. They will discuss the trip with you. And at the end of the consult, you have a compliance form, and you're asked to go to bring the form back to our office. All right. We also have one of the most important things, and I think it's the #1 prerequisite for a successful program, is preparation. The more the student is prepared, the more the chances that the experience will be rewarding and successful. In order to ensure preparation, Hofstra University, our programs come in with program-specific meetings. It's at these meetings where everything having to do with the program is discussed. Academic issues, practical concerns, such as how much money should I bring, or should I bring a phone? All these are program-related concerns. We also come in now with our pre-departure orientation, which only we hope will expand everyone's knowledge about the more critical issues of study abroad, which include health, safety, and well-being, okay? So these 3 things are in place during pre-departure. Once the student is abroad, Hofstra University provides short-term insurance. Short-term insurance through the Allen J. Flood companies. The actual insurance is Axis. We've just made a change about a year ago. In the parent packet, you will see a sub-packet which has insurance information. It has the provisions as well as the exclusions. So if a child, let's say, is in Athens, London, or Venice and feels the need to see a doctor, the doctor is called in. The student would pay in cash, all right, in euros, in this case, in pounds, and would then come home and put in a claim for reimbursement. Just remember, you have to have the receipt, all right, of the particular service of the visit. But however, I have all the provisions in. If parents look at the provisions and are not happy, because again, it is short term, they can call the Allen J. Flood companies and get an extended insurance. This insurance has nothing to do with travel insurance. I'm getting calls, I'm getting emails about travel insurance. Travel insurance we do not provide. Travel insurance, you would have to go through a travel agent. And I reached out to our agent at Pro Travel, and they do have travel insurance, so you would have to get in touch with them, okay? In addition to providing insurance, we have other things that are in place. These are things that in the past we say we request. This time, in the wake of all this disaster, we are going to say it is required, and that's weekend travel. All right, now, basically, as far as all our programs, our 3 programs, they really follow the same structure. Monday through Thursday is when the program runs. Classes run generally Monday through Thursday, about 9 a.m. through about 12:30. We have excursions during the week. The weekend actually starts on Thursday, right after class. Students have the right to go and do independent travel. Now, as much as we believe that independent travel is part of is a critical part of the study abroad experience, of the international experience, we honor students' requests from students who say, I would like to stay in Athens, I would like to stay in London this weekend, I'd like to stay in Venice. So please understand that we're not throwing you out, okay? You have every right to stay at home. As directors, all right, and it's myself, Barbara Lukassis, John D. Gaetani, we do not have a right to say, to restrict any independent travel, okay? It is not something that we do. We can make suggestions, recommendations. This is all based on our continually monitoring all the critical websites, CDC, the U.S. Department of State, okay, and also information that is given through the U.S. embassies in the various locations. All right, but right now, students who opt to go away from the host city, what we're going to say is we are going to require, notice I'm using required, not requesting, that students sign out with an itinerary of their weekend plans. And again, this is not something that we're saying, and I'm looking at faces, you know, no reason, and Venice has always done this, so. We're not out to control you and find out what you want, what you're doing. We're doing this as a safety precaution. And if you look at any other study abroad provider, any other university, this is in place. So again, it's not going to be something that we're going to say request. It's going to be stronger. It's going to be required. You are to give the name of a hotel where you're staying, a phone number, the group of students that you're traveling with, and a cell number, just in case one of us needs to reach you or a parent calls one of us and wants to speak to his or her child. As well, you return back, you will sign in. We will also ask you, even though our programs do not have curfews, we will say to come back no later than midnight. And again, this is being done for safety precautions, okay? So that's the number one thing, the insurance, okay? All our directors have a cell phone. You will have access, parents and students will have access to that phone number, all right, to that cell number. I say that the number can be used 24/7. If there is any concern at any time from a parent or student, if there is any question from a parent or student, call us, okay? The director is your first line of contact, parents, which means please don't call Hofstra. You need to contact us. Extremely, extremely important. One thing that I'm happy about is that the three of us, as far as directors, have an extensive experience running our programs. And I'm really, really happy about that. There are many programs that rotate directors. We have not. And it will continue. So, what does this experience give us? We all have a love for our city. I actually tell people I know Venice better than I know my hometown here. But the importance is that we've had the opportunity of cultivating so many people. Hotels, owners, staff, restaurant owners, staff people, local police. They all know us, and they really appreciate us. They look forward to our coming. In case of an emergency, which I do not foresee, they will be there, and they will assist, okay? So pretty much these are procedures pre-departure and during the time the program runs. And the most important thing is, all right, as far as Hofstra is concerned, health, safety, and well-being abroad. Now, two things that I have introduced in the wake of the Paris attacks and the worldwide travel alert that ensued right after that. One thing that I'm going to do, and I'm hoping to do it next week, is enroll directors, faculty members, and all participants for the three programs, South in London and Venice, in STEP. STEP is a Safe Traveler Enrollment Program, and it's a free service by the U.S. government for U.S. citizens abroad. By enrolling us in this program, what we're going to be doing is, A, should there be an emergency, the U.S. government will be better equipped to assist us, and we will be getting routine information on a daily basis from the U.S. embassies as well as the U.S. consulates. I'm hoping to do it this week. I think I can do all three programs, including participants, faculty members, directors. Should I have a problem and they will not permit that, I will reach out to our students, and I will ask our students, each student, to register on his own, her own. All right, but I think we could do it. I think I could do it. I don't think there's going to be a problem. In addition to which, since in the wake of the Paris attacks, our office, as well as other administrators, continually monitor critical websites, CDC, again, the U.S. State Department, the embassies, to make sure that there is no status change, okay? And that will continue once we're abroad as well. All right, now, I'm going to turn my attention to the student and what the student can do to ensure his or her safety. And again, keep in mind that this pre-departure started because of behavior or misbehavior of a group of students. And as everyone will say, it just takes one or two, and it's a domino effect. Student has responsibility to make good choices abroad, good decisions abroad. That is going to make the difference between a successful and a non-successful program and experience. What the student can do, and we're almost at a point, and I know students are counting the days, and I say, please don't count the days, because we need more time, all right, so don't count the days and the hours, because it's very scary to me. And it goes very quickly, by the way, those 3 weeks. So savor every minute now, here. But prior to this pre-departure orientation, you have had the opportunity to attend program meetings, program-specific meetings. You have had the opportunity, hopefully, to meet other students who will be sharing this wonderful experience with you. But you've been able to gather information regarding academic objectives, your everyday routine, excursions that are set up by the program, independent travel, okay, which is excellent. We ask you between now and the date of departure, start doing some research. If you have not already, start doing some research on your host city, host country. Get to know its customs and laws. And a little word about laws, okay? We think they're universal. So what is permitted here is definitely going to be permitted in Athens, London, and Venice. No, that's not the case, all right? What is permitted here may not be permitted there. Just a word of caution. If you break a law and you're consequently arrested, neither Hofstra nor your U.S. government will do anything or can do anything to get you out. So, again, research, prepare yourself. Again, preparation is the most important thing that you, as a student about to embark on probably the most exciting experience of your entire college career, all right, best thing that you can do. Once you are abroad, responsibilities academically, culturally, behaviorally, very, very, very important. Academically, we ask you to do what you do here when you go to class, all right? Go to class, be on time, engage in discussions. One of the things with study abroad is it's not only classroom, being in a classroom, but it gives you the opportunity for experiential learning, hands-on learning, and you'll be doing so many things with your groups, the various classes, outside of the classroom. All right, please take full advantage of this. Culturally, please take an active part in all the excursions that the program sets up for you. From a practical point of view, you've paid for it. So do it, take advantage of it, right? But more importantly, it's going to add to your cultural development. It's culturally enriching. So take part in that. In addition, develop your cross-cultural skills and become immersed in the culture, whether it be in Athens, London, Venice, all right, and show a willingness to adapt to the local ways of life. One of the things, and our office sees so many students before, before the trip, after. One of the questions I always ask is, what do you think 5 years down the line you'll remember about your study abroad experience? 9 out of 10 times, the response is, the people that I met, the locals, they showed me the best places. We did wonderful things together. And I now have a group of wonderful, wonderful friends. So we ask you to get to know the locals, see how they live their lives, try to adapt to it. It seems hard at first, but once you do it, you're not going to go back. All right? Behaviorally, we ask you to act maturely, responsibly. Please keep in mind that whether you're here on Hofstra campus or abroad, you're subjected to the same code of conduct. At all times, something very easy, we ask you to be courteous and respectful. Not difficult to do. I always tell our students in Venice, a smile goes a long way. A request goes a long way, as opposed to do it now I want this. Okay. To the people in your group, to your hosts, extremely, extremely important. Please keep that in mind. As well, we ask you to abide by the laws of your host city, your host country, and abide by the regulations set forth by the program. Regulations aren't something that, they're out to get us, they're out to control us. No, we're not. It's all for your safety. Okay. As Dr. Costanoble mentioned, there are many things that threaten your safety abroad. The more common ones are always based on a student's behavior or misbehavior. Excessive drinking is the biggest. And it's very emotional for me because, as Steve mentioned, we've seen it. Through the years, I've seen it all. We've done it all. Excessive drinking is not only a threat to each person, to the safety of each person, but also to the right of every other participant to enjoy a successful and rewarding study abroad experience. So please remember that. In many places, it's culturally offensive. It may be in Athens, London, Venice, and actually I always relate a story. One year, and it doesn't have to do with Hofstra students. It was a Saturday afternoon, late afternoon. I was going to see some friends, and I was walking. And Venice is walking city. And there were 3 young gentlemen in front of me. And this must have been 4:30, 5 p.m. Excessively drunk. Venetians were turning around, stopping, and looking at them with such disgust. And I just wanted to melt. I have stories that we could spend 20 minutes on talking about as far as what happens and the consequences and the dire consequences. We almost lost a student, all right, due to excessive drinking. So, if you're going to drink, we ask you to drink responsibly, in moderation. Most importantly, know your limits, all right? The one person we almost lost did not know her limits. And I'm glad that Steve mentioned also, you're a representative, an ambassador, and you are an ambassador and representative of your program, your university, and your country. I'm sure that you know that the European perception of the American student is very, very low. Do we know that? Does anyone know how the American university student is viewed, is perceived? Any idea? Dan? Are we aware of it? Do you think that Dan exaggerated? No, absolutely not. Okay, because he took the words right out of my mouth. All right, basically very loud, very obnoxious, excessively drinking, excessively partying. That is the European perception of the American university system, the American university student. I pray, and this looks like a wonderful group, that we do something about it this January and take that stereotype and show them that they are wrong. I always, with everything that I've been through as far as the program, I still love what I do more than anything else in the world. And I will continue to do it. And as far as study abroad is concerned, encourage students to do it because it is an opportunity of a lifetime. And before I turn my attention to our Dean of Students, Sofia Pertuz, I thank parents again for giving their child this opportunity. And I think you deserve a hand of applause.
Good morning. That's why I love Maria. She's the only one that I know that says my name in Spanish, and I don't even do it. I say Pertuz, and she's like, isn't it Pertuz? I said, yes, it is, but I don't even do it. Well, good morning, everyone. I'm not going to repeat too much of what Maria said. She's already said that the standards that we have here at Hofstra for your students, which all of you have read the Guide to Pride cover to cover, right? Some of you are RAs in the room and know it well. So I won't repeat any of the specific details in the Guide to Pride, except to say that they still apply. Anytime that you're traveling on behalf of Hofstra, representing Hofstra positively, and even if you're not representing Hofstra positively, that's when there are moments when we may need to step in and just remind you of those code of community standards. So what happens is, if you're on your trip, I hope that we never have an opportunity. This is my first year and a half here at Hofstra, and so far in my time, I haven't seen anyone have to come back from a trip because of behavioral issues. So give yourselves a hand as students that we've raised standards. Because I did hear some stories from the past, but I think students are becoming more aware, really thinking about their behavior and being conscientious and just being really good with each other. So I just want to say that I would like that to continue, and I want to offer myself as a resource to you. The easiest way to reach me is to just send me an email, deanofstudents@hofstra.edu. Pretty easy, right? You don't even have to remember if I have a PH or an F in my name. Just deanofstudents@hofstra.edu. So what happens during your trip for students, if there's something going on, if there's an emergency, call your director, call the local authorities there. Do not send an email, because we may not check that as often as you would think if it's an emergency. But if there's something that happens, what has happened in my time is a student will send an email saying, I had this interaction and I'm not sure what that was about. Whether it was a harassment in nature, sexual harassment in nature, or some other odd kind of thing, you can reach out and we will have a conversation and kind of work through what to do next and how to handle it while you're there or even when you come back, if it's something that's happening among students. You know what happens with social media, Facebook, Yik Yak. I hate them. No, I love them because I think it's really great for community building, but sometimes people post things that are not appropriate or, some other things happen there. So whether it's any of that kind of stuff that you're not sure, we're here as a resource to you. And to parents, we're a resource to you too. If there's an opportunity that you want to just reach out and talk through, something happened, my daughter shared something, my son shared something, and you just want to figure out what the policies are or want me to explain our process, our conduct process, I'm happy to do that anytime. And I've offered that during orientation, during any time that I stand before you. And of course, you have Branca, who will share more details later. You're going to hear from Karen O'Callaghan regarding very specific safety measures that you can take to protect yourself. The same way that we tell you anytime you're going to go out in groups. Look out for yourself. Don't carry wads of cash in front of you. If you have wads of cash, great. Awesome. But don't be so blatant about it if you do. And just the last thing I want to say is that, again, you represent Hofstra wherever you are. So we want that kind of positive feedback when you get back. I would love to hear about your trip. I sit down with several students when they've gotten back from last year. One of our students went to France, I believe. I'm sorry, it was the London trip last year. And they were so excited about it that they came and made an appointment just to tell me about it. And I love to hear that. Love to hear it. So again, I'm a resource to you. Let me know if you need anything. I'm a parent too, so I have to run across the street and get my kids out of a computer class. So thank you so much, and I'm so excited for you. This is going to be the best way to learn about others and yourself is to leave the country. Go somewhere else and really learn and really get to know and immerse yourself in the culture and have a great time. Not too much of a good time, but enjoy and really experience and learn. So thank you, everybody.
I would ask now Dr. Maureen Hock to just speak a little bit about health issues.
Okay. I'm a bit taller. Good morning. So I'm the director of the Health and Wellness Center here, and all of your students have been asked to make an appointment at the Health and Wellness Center, and I know some of you have. And what we do there is we will actually go over some of the planning on your trips. Each student will receive a copy of their medical record, their medical history to take with them, a copy of their immunization records, which all of you had to submit at one time, and we also actually give them a copy of the CDC requirements for this country in which they are going. We also will go over any kind of information that they would need or that they require or that they ask for. So if a student has a medical situation going on, we will discuss that. If a student has prescriptions that they need to take with them, a suggestion that we have is that you keep all prescription medication in the bottles that they come. I know it's a whole lot easier just to take one bottle and just put all your pills in one bottle. Not a good thing, okay? Keep them separate in it. A suggestion we also have is that you take an extra prescription with you or to keep an extra prescription at home with your family before you go. How many people here wear contacts? Take your glasses with you in case anything should occur to your contacts. You don't want to be over in Europe and not have your contacts or be able to see, especially if you're in a classroom, okay? And I can't tell you how many students come here to the university and don't bring their glasses with them and then end up with an eye infection and can't put contacts in and then don't have a problem, okay? So what we're going to do is if anyone has allergies and extremely severe allergies, a suggestion we would ask them is to take an EpiPen with you. Another suggestion we have is to take something like Claritin, which is a medication, you can get it over the counter. Again, it's an allergy medication, but helps tremendously with just some general allergy problems that you would have. Let's see. Again, some over-the-counter medications you may choose to take, which might be a medication for diarrhea, some of the antihistamines, which would be Claritin, some Tylenol, and these are just general over-the-counter medications. Remember, and I think it was Maria who had said that laws are different in Europe, just as medications are different in Europe. Things that are prescription here are not necessarily prescription in Europe, and certainly medications are very different there also. So for our students, I want, if you can raise your hand, how many of you have had the flu vaccine? Not a whole bunch of you, huh? Okay, so I strongly recommend every single one of you have a flu vaccine prior to going, okay? Influenza is not only a disease you'll find in the United States. It does occur in Europe, and you're paying a lot of money to go to school over there. You don't want to get influenza when you're over there, because influenza does not occur in a 2-day cycle. If you get influenza, it's going to last 7 to 10 days. It's like being hit by a Mack truck, okay? Your invest in getting an influenza vaccine will save your trip if you should get sick. So you really don't want to end up in Europe and end up spending half the time sick in bed. So a strong suggestion, we have influenza vaccine over at Health Services. I don't even have as many doses as there are students in this room right now. So I suggest that you either come here or you go to your primary care provider and get it done before you go. It's important. I know a number of you have come over for your evaluation, and I do appreciate that. I would suggest that those who have not make your appointment sooner rather than later. I can tell you that I've actually had students make their appointment for the day they're leaving. Not a good idea, okay? Especially during intersession when I do not have an entire staff available to do that. So Maria and Steve actually spoke about some of the other issues that we've had, and I need to address those issues too, and that certainly has to do with drugs and alcohol. And as you know, mostly in Europe, the legal drinking age is 18, and obviously that's not here. So when we talk about drinking, and it will be legal for you to do so over there, and we talk about drinking in moderation, that's not something that many of our students here exactly know how to do. Also, I need to say, in England, beer is not the same alcohol content that it is here in the United States. So you need to be concerned about what it is. And I can tell you how many of you know what a drink is. What consists of a drink of beer? Can anyone tell me? One of you students. What is a drink of beer? How many ounces? 12. Okay. How about wine? 8 ounces for wine? No. 4. Okay. Yeah, 4 to 6, not 8. Okay. It's pretty good. Okay. And how about hard liquor? Alcohol? 1 shot. But what does a shot consist of? 1 to 1.5 ounces. So a Long Island iced tea is not 1 drink. Okay, so let's get that settled right here. Okay, so, and how long does it take your body to clear 1 drink? Anyone know? About an hour. Okay. 8 hours? Okay. So if we say it takes 1 hour to clear 1 drink, so if it's 12 ounces of beer, and that's the beer here in the United States we're used to, which in alcohol content is very different than what you're going to find in Europe, so that means 1 beer an hour. So as we said, if you're going to go out and you're going to go to a local establishment over there, not that you go to them here, but over there, we're going to say 1 drink an hour. Okay? But you also have to remember that if you are on medication, those medications can interact with the alcohol that you're drinking. Be aware of that, okay? And you need to know what medication you take and how it can be affected by alcohol. And I've had students say to me, I can't drink because I'm on so-and-so types of medication, which is a wonderful thing that you are aware of those things. And I appreciate that. The other thing, and certainly people talked about, is that and these are things that I would tell students here in Nassau County. When you go out in a group. When you come home, go home with the people you came with. Okay? If you meet Cinderella or Prince Charming, take their numbers. They'll be there in the morning. Okay? If you have any questions for health services, any questions for your medications, I see some parents pointing over there, so I'm not going to look. But any questions, don't hesitate to come over to health services, and we will talk one-on-one, okay, with a healthcare provider. I have to tell you, I have been doing this since we started. I keep volunteering to go. They won't take me with them. So have a wonderful time, and I envy all of you. So.
All right, now we have, Bronca, is there anything you want to say? Okay. What we're going to do right now is take some questions. Please keep in mind, I mean, the most important thing is really safety, health, well-being abroad. I mean, I've been getting some questions, which I've should have made a copy of. One of my last packets, which I sent out to parents, and by the way, again, I thank you for your support. We've had this wonderful community going between parents and our office, and questions and concerns, and I appreciate it immensely. I apologize if I have not been able to get to some of our particular questions. I will get to it. But the last thing, and actually I have asked WebWork to post the parent packet information. And hopefully they're doing it. I generally get some kind of a confirmation that that's been done. But the last thing, and we put it in the student packet as well as the parent packet, what safety measures are in place for our January programs in Athens, London, Venice, and we also talk about some of the things in the wake of the Paris attacks. First of all, though, let's parents, any questions? Now is the time to ask. As far as health, safety, well-being, weekends, are there any questions? Yes. My recommendation, and I'm going to ask our other two directors to also chime in. The recommendation that I would have is if a student is traveling and is outside of the host city, to go to the closest hospital, go to the emergency room for the most part, and I don't know if it works with Athens and London. I know in Venice with our hospital, if I have to take a student to the emergency room, it's triage, so we will spend time there waiting, but at the end, they just request the passport. They do not charge. But that would be my recommendation. I think that's the safest way to go. Or the student staying at the hotel could ask for a recommendation for a doctor. They may have a doctor that they know that would come in for guests, just like with our hotels in Venice. If a student tells me, I'm not feeling well, I think it's the flu, I have a fever, we call in a doctor that has been with the program for a while now and happens to speak English perfectly, and students feel very, very, very comfortable. Any recommendations, Barbara, John?
Well, I have found that both in Greece and even in traveling in England, if you need care, we will not charge you, or we will be charged a minimal fee. Every time we've needed a doctor, for instance, in Athens, we've actually absorbed the cost from the program itself because it's so little, even for emergency services. And I know, no,
It used to be free in London.
No.
The national health would cover everything. Not anymore. It was costing them too much money. The first thing they'll ask you, are you a British citizen? If you're not a British citizen, they'll charge you. But it's very moderate and they take credit cards. And the hotel is about a 5-minute walk from the National Health Office in Soho Square. So it's, and also the staff at the hotel is doctors and dentists and the staff that's recommended will come to the hotel. But there's a branch of the National Health Service very close, a 5-minute walk from the hotel in London. But it's not free, they're going to charge you. But it's moderate, it's not real expensive. One of the tricks of successful international travel is don't get sick.
Get your flu shot.
Get your flu shot.
Let us an emergency after there are hospitals, there are doctors, and they speak your language.
Any questions related to allergies? Is there any student here who has any kind of allergies? Yes? Okay, now, so in Athens, my suggestion with any students who have allergies, at least what I do in Venice, is supply the student with a letter stating, this person has, because it's one thing when the student is in the host city and dinners are with the group, I can speak to the staff at the restaurant, but when the student is doing independent travel, the student really is on his own, her own. I supply a letter, furnish a letter in Italian saying exactly what the allergy is. In London, that's not needed because it would be like, what do you do here when you go to a restaurant? You say, look, I have a nut allergy, or I have this shrimp allergy. As far as Athens, did you have any student with allergies? Okay.
I like to touch herbs and smell them when we go on excursions. I must have had a the flame. It's so itchy. Luckily, one of the students had Benadryl, which obviously no, I make sure I take Benadryl with me.
Yeah, well, if you have allergies, of course, bring your medication with you. If you have asthma, bring your medication. You have to warn people about it, and it's your responsibility to tell the people in the restaurant you can't fish, so they'll know.
This pharmacy is always designated and open all night.
Right. Same thing in Venice.
The pharmacists are great. They're almost equal.
Yeah, to doctors, MDs. That is true for Venice as well. In fact,
Also true of London.
Okay, so it's true of all three. That's why we all get along. That is very true. If I have a student says to me, I think I did too much walking, my knee is bothering me, rather than wait at the emergency room, because it's going to take at least 2, 3, 4 hours, I would say let's go to the pharmacy, and the pharmacists, they're just as good as MDs, and the pharmacist will take care of it, give you some kind of a soft bandage, whatever, so that you could just rest that knee. Any other questions? Yes. Where are my previous participants for Venice? Previous participants. Okay, so I have Anna, and where are my other students are they still outside? Ali, do me a favor. Could you just see outside and get Alina and Janine and Carolina to come in, please? That may have been, several years ago when we came up with that with the calling card, because up to about 3, 4 years ago, we did recommend calling cards rather than phones. The majority of students do take phones. However, you're going to hear that some students will say, I never use my phone. Okay. I think phones are good also to connect with students as far as when to meet, where to meet, texting. Okay, so perhaps in the last 2 years that has changed, but I think calling cards are good as well.
There's a lot of options now that weren't available some years ago. First of all, it's gotten cheaper to take your phone with you. Everyone has international plans. That's why I use my American phone while I am in Greece, because it is now more expensive. Say, they do have plans. You can get a cheap SIM and put it in your phone. However, the roaming fees and the taxes are so exorbitant. I mean, I have T-Mobile. It charges me 20 cents a minute, which is pretty good. Now, in England, they have these Libera plans that are wonderful, and for £10, you can just have all kinds of service with this. So it varies, but I think it's worth it to take your phone. Only don't lose it, don't leave it on the table.
In regard to your cell phones, please call your providers and double check about international plans. I would guess that it's going to be expensive to use a phone. So do not use data off in Europe. Go to the Wi-Fi areas, hotspots, use WhatsApp. So your parents have to have WhatsApp on their phones, and you have to have WhatsApp on your phone, and free calls.
All right. In respect to that question, if we could just, there are times when a previous participant, and we always try to have previous participants at every meeting. They are perhaps the most vital, invaluable resource. And we have 3 students here who were on last year's Venice program. As far as phones, who had a phone? Well, actually, Janine was on the 14th program, and Alina and Carolina on the 15th. Did you bring a phone?
My mom is not really tech savvy. She doesn't like doing Skype or FaceTime, and she thinks that she'd rather have phone calls. I have AT&T, and I know that right now they have like 3 options for international phone. Depending on the best for you. It was expensive, but she thought it was worth it because through FaceTime she could like barely talk to me, and she said she would just text me or call me.
Could you just repeat? Because they can't hear.
couldn't hear you.
Oh, I was just saying how I didn't really use my phone that much because we were always really like traveling in a group when we were together. And if we weren't, we were at the hotel and we would Facebook each other saying like, hey, you want to see each other this time and go over what you're doing this weekend. And then when I would get back to the hotel at night when there was Wi-Fi, that's when I would call my parents and just let them know that I was leaving. And then at like the restaurant in Hofstra, so I could see that Wi-Fi.
Can you text? Can you text? Can you text? Just WhatsApp.
Even like Facebook and stuff, any apps that you have will work with the Wi-Fi.
And also, the hotels have phones. You could call the hotel, and you could talk, if you have a client from home, if you have a landline where it has an international thing, you can talk for hours.
Right.
So, that's
Any other questions? We have, yes. No, not a problem.
What if the student loses their passport? Is there any emergency procedures that are
Did you have any students losing passports? I have. Want to- Okay. What the student would have to do is go for a permanent passport, go to, let's say, as far as to Venice, perhaps go to Rome, to the U.S. Embassy, and would be able to get in one day, I don't know how many hours, I'm sure it's going to be, maybe 3 or 4 hours, would get a permanent passport. Or can go to the nearest consulate, and would be able to get a temporary passport for 6 months. Okay, I just had, in all the years I've been doing the program, just one student. We're not going to get into that student as far as everything else that she lost. Okay. And again, you learn from your mistakes. I think in my regulations we say, please do not bring the following items. You do not need them for fraud, bank account, keys. But it can be, but we really stress the importance of the passport. We always say to students, keep the passport in a safety deposit box, okay? When you're in your host city, if you feel more secure, you can have a copy of your passport. Don't carry your passport everywhere with you, okay? You really need, that's your one important document. When you're traveling outside and you're doing your independent travel, yes, you're going to need your passport. By the way, your passport, when you register in each hotel, they're going to take it for a couple of hours, maybe a day. All right, don't worry, they're not doing anything with it. It will be given back to you. Yes, Bronca.
By the raised of hand students, did you look at the second page of your passport at the expiration date? How many of you did? Your passport must be valid 6 months out from the departure date.
Yeah, so in other words, it's 6 months once you get back. It's valid, it must be valid 6 months from the date we get back. For example, with Venice, we're back the 21st, figure 6 months from January 21st. Very, very important. Actually, we did have a student who, and I think I had more than one student, who in different years, we could write a book, in different years were stopped, all right, because their passport you do further research in the international, in the various categories?
I haven't.
Mrs.
had
Edwards,
time.
correct.
Yeah, I haven't had time, but it's working. There's 3 levels with international student ID card. And because it's international, it's good here as well. So the first level gives discounts into restaurants, some different travel, maybe on a bus or something like that. The next level for $99 offers some travel insurance. And then the third level for $199, it covers travel insurance, business interruption, medical coverage, the host of things that will cover is amazing. And it works here as well. So if you should go to Boston or you should go on a ski trip, you still get all of these things. And as an example, if you go into Loma, you get an $11 discount on it here. For the whole year. It's, I would suggest, I'm going to do it, the contract got away from me. I'm going to do it this weekend because it takes about 3 to 4 weeks to do it online. To receive it. It's just a pretty simple form to get it. And then you can go to one of the locations just as you would for a passport. You wait until you get that minute and then you get a passport. But then it's time and money. If you just Google international student ID card, I think the website is isic.com. And it's all there. And it gives you the breakdown of 2%. It's so comprehensive that you can spend a couple of hours on it. Can you get it now? Well, this trip is what, 4 weeks out? So you're going to be pretty close. But for $200, it covers lost baggage. It covers hotels if you're traveling and they get stuck. It covers a lot of different kinds of transport, medical. I think it's worth it considering the cost of the trip. So it's a drop in the bucket.
Yeah, is there a question? Could you repeat, please, Mrs. Edwards, the website?
isic.com.
Thank you. Okay, and I have spoken to my senior associate team for budget. And after your call, I mentioned that we should look into, because again, when I received your call and you asked, oh, what about international cards? I said, well, our students have a Hofstra ID, and we always encourage bringing that. And then you started to tell me all the other possibilities, and I said, we should look into it and maybe seeing one of those, but it's too late now for January. I think we should look into it to see if it could be, let's say, provided